Is it okay to be getting our drugs from Mexico? Find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got Tina Nunziato sitting right here by my side. Thank you so much for joining us. If you are one of our first-time listeners, we welcome you. If you're one of our regular listeners, we thank you for always being on this journey with us. And we know everyone has hectic schedules, and so it means the world to us that you are taking the time to listen to us or watch us if you're watching on YouTube. All right, so let's jump right into drugs from Mexico. I think it's a great topic because through my over 20 years of practicing, especially here in Arizona, I've actually been asked multiple times throughout the years, hey, is it okay that I got this medicine from Mexico? I couldn't find this here in America, so I went to Mexico, got the medicine, didn't even need a prescription.
Or it was too expensive here.
Or it's too expensive, exactly, exactly. And so I think it brings up a good, great topic to discuss because nowadays, people can order medicines, online. You can order them from Canada. You can probably order them from Mexico. You can just go across the border. We're here close to Mexico, just a few hours away. You could go across the border and get medicines, and it is kind of cool that in Mexico, there are pharmacies everywhere where you can pretty much walk in and get a lot of medicines that you would not be able to get here in the USA without a prescription. Okay? There are a lot of over-the-counter medicines that you can get here that, and there are a lot of them. And but there are medicines that you can actually get in Mexico that you could only get by prescription here in the US. Antibiotics is a big one. And but there's all sorts of medicines out there. There's even medicines that you can get in Mexico that maybe are not even being I don't want to say they maybe have been approved, but for some reason the FDA said, put a ban on those medicines. And some of those medicines you can still get in Mexico, because I've had some patients bring some of these medicines and pull them out of their pockets or their purses and say, hey, what about this? I'm like, oh, the USA banned this 10 years ago, 20 years ago. And so you can go. The last time we went to Cancun with our family a couple years ago, and pharmacies everywhere, and if you walk into the pharmacy, like to get a bottle of water or to buy some snack, they're hitting you up on, hey, we've got these medicines.
They're trying to push the medicines.
They are. They're really trying to push the medicines, which I also found interesting. So how about it? Is it okay to get medicines there? Well, I will admit that I was a little bit biased towards just getting medicines in the USA for most of my career so far. And I would usually tell patients, look, you have to be careful. You should probably just be getting medicines here in the USA, probably because I didn't know any better, But however, when we decided to do this podcast, this podcast topic, I did a little research, and lo and behold, I actually discovered a lot of stuff. I discovered that these medicines that you can get in Mexico are also made by the same pharmaceutical companies that make our medicines here.
Shocking,
right?
They just slap a different label on it.
Exactly.
And put it in Spanish.
Put it in Spanish.
Send it on its way.
Exactly. But they're the same medicines. Why are they so much cheaper? Why are they so much cheaper?
I find like going to Walgreens or CVS and you're looking for even an over-the-counter medicine.
Right.
And they'll have the name brand medicine, and then they'll have like the Walgreens version, right? Or the CVS version of the medicine. And you look at the ingredients and it's exactly the same, but it's so much cheaper.
Exactly,
right?
exactly. Well, so I'm going to come back to the question I just asked, why they're so much cheaper. But medical tourism is a huge thing. Okay, it's a huge thing. In several countries, but Mexico is one of the top countries, and it's accredited by the international medical associations, but it's a big place for going to get your medical care.
A lot of people go there for their eye care,
exactly,
their dentistry,
dental,
stomach, if they're having like a sleeve done or something like that, just because it's so much cheaper. Even we had a friend that was just telling us that they just crossed the border and there's like a lineup of dentists and eye places.
Exactly.
And they may have an appointment at one of them, for example, but there's guys coming around with golf carts being like, hey, get in our golf cart. We're taking you to our dentist place or our eye place or whatever. I mean, it's almost like they're selling chicle on the side of the road when you get to these places, but like just a strip of dentists and eye doctors.
Yep.
Yeah.
Absolutely.
It's incredible.
Absolutely. And it's my only concern has always been that, God forbid, like especially if you're having a major thing done, a gastric bypass or some sort of weight loss surgery. I mean, those are the main ones that I've encountered where patients did have a surgery and then maybe had some sort of complication. Maybe that occurred immediately or maybe down the road. You have to be able to get back in the car or the airplane or whatever and go back, or find someone here in the USA that's going to be willing to take care of you when you just had this major surgery done, somewhere else.
Right.
But medical tourism is a big thing. Mexico is one of the top destinations for medical tourism. But as far as the medicines go and why people can get these cheaper, one of the big things that I found was that they don't slap on these pharmacies, in Mexico, and there are. You can Google some of the top pharmacies that are like pharmacy chains that you can go and get your medicines at there in Mexico, but they don't slap on these extra costs that come on top of that they have to add on there because of the risk of litigation like they do here in America.
We love to sue people here.
Yeah.
And that then is a result of why our medicines are so expensive. Apparently.
Exactly.
Yeah.
Exactly. Because, they have to get this insurance to, liability insurance. So I guess that's one of the reasons, and there may be many more that I'm not aware of, but that was one of the big things that popped up when I was doing some reading on getting medicines in Mexico.
That the medicines are safe, so to speak, because they're coming from the same pharmaceutical companies, but that they're cheaper because they don't have to tag on the extra fees for liability insurance. Okay.
So it is I think it's totally cool that you could go there and you could get medicines and you can, antibiotics that, that typically are going to cost a lot here and that you need a prescription for. I can't think of an antibiotic that you don't need a prescription for. Maybe you can get over-the-counter, creams, antibiotic creams, like first aid kit type stuff. But I don't think that you can get a prescribed, an antibiotic without a prescription here. Whereas in Mexico, you can get antibiotics, and
which is also a little scary.
Well, it is, so that's a point I was going to bring up. Is that it's awesome that we can go there and that you can get these meds, and the pharmacists are very educated and are able to say, okay, this is for this. However, the scary part is that you can also get medicines, typically prescription medicines, buy them there without a prescription, and not really understand what it's for. And the reason that this whole thing came up was because we had a family member that reached out to us and was like, hey, we got this medicine in Mexico. We were just there and we got it for belly pain, abdominal discomfort, stuff like that. Just want to check and make sure that you agree that this is okay for us to take and use. So they send me the name of it. I look it up. I'm like, this is for allergies. this is for allergies. This is not, has nothing to do with any abdominal or GI issue. And so what Tina was going to say is, the scary thing is that these medicines are all out there. You can buy them, but if you don't know what it's for, if you don't understand why you're taking it, you could be taking something, putting some drug into your body that is, you know, maybe going to harm you, you know?
Well, and even antibiotics specifically. I mean, they're prescribed here for a reason because, first of all, we tend to be a very heavy antibiotic country to begin with. And I feel like the amount of antibiotics we take is in direct correlation to our gut health.
Right.
And the more antibiotics we take, especially as children, the harder it is on our gut. And we tend to go to the doctor, and even if they, for example, even if a child maybe has a sore throat and they haven't fully been diagnosed yet with strep, they're still giving them an antibiotic, even though we don't know yet if that's what it is, right? Do you truly have an infection that requires antibiotic? We just give the antibiotic, right? So that's already a little sketchy. But then on top of that, now you can go to Mexico and get whatever antibiotic you want and just be taking it. You start getting sick. You're like, I'm just going to take this antibiotic, you know, and maybe you don't need it. And again, it's messing with the gut. And so now we've got access to these antibiotics. Maybe we're not taking them for the right reasons.
Right.
And we can get used to these antibiotics. There's people who are not reacting now to antibiotics because we're taking so many antibiotics. And it's scary to be resistant to antibiotics because when you really do have an infection, now you can't fight it.
Absolutely.
Okay.
You know, and you have to understand that different antibiotics are used for treating different types of infections. It's not like we use the same antibiotic for treating a bronchitis, a pneumonia, a urinary tract infection, or a stomach infection, a colon infection, diverticulitis. You know, different antibiotics are used for different purposes. So you have to you need to be aware of that. That, you know, you don't want to just, oh, let's just get this antibiotic, and the next time you develop some infection anywhere, you just take it, because that may not even do the trick. That may not actually help in treating that certain bacterial infection. The other thing to keep in mind, you know, in addition to what Tina was saying is, you know, about developing resistance, and then when you really need that antibiotic, it's not going to do anything for you because your body's developed resistance to it, is that and I would say this in particular to respiratory infections, is that not all respiratory infections are bacterial. Okay, sometimes a lot of them are virus, which means that you've got to just give it time, a tincture of time, and you know, just nursing yourself back to health, because no amount of antibiotic is going to kill off the virus.
Yeah, we tend to we get sick, we need to take a pill. Get sick, take a pill, right? And that whole thing of I got to get better by tomorrow is very dangerous for the body, because look, your body is a healing vessel. Its job is to heal you and keep you well. And sometimes all it needs, like Dr. Cruz says, is time. I like that, a tincture of time.
A tincture of time.
Sounds like Mary Poppins.
Yes. So anyways, it was, so look, I did open up or kind of release some of my biases upon realizing that these medicines are made by a lot of the same pharmaceutical companies that make our medicines here. And I would say that's probably the same for all over the world, because I think a lot of these big pharmaceutical companies, Roche, Pfizer, I mean, they probably have pharmacies, I mean, or factories all over the world. They're huge. The pharmaceutical industry is a huge industry. And so yes, I think that taking medicines that you got in Mexico are probably fine to take. However, you need to know why you're taking it. You need to make sure that it's the right medicine. And that you're taking it for the right reason, so that you don't cause more harm to your body. And because you're trying to treat something, and the last thing you want to do is now throw in a drug in there that is just going to cause potential side effects, adverse effects, and not even do what you need it to do. So just make sure you're educated on it, And I guess that's it.
Yeah.
I mean,
we just want to make sure we share that message.
and I
with
just want to
everybody.
make it clear that we're not promoting and trying to say,
to
hey,
Mexico."
go to Mexico to get your medicines.
People are doing it.
Yeah, people
Yeah,
are doing
we're just here
it.
to
Just know
educate
what
those
you're
people.
taking.
Yeah.
Yeah, just understand what it is that you're taking and look it up. I mean, you can look up, there's so much information on the internet these days. Put the name of the drug in and look it up. You're going to get a lot of great information. So if you want to connect with us, you can find us on our website, drlizcruz.com. There's a magenta colored button on the homepage. You can click it and schedule a free 30-minute wellness consult. That can be done from anywhere in the world because it's done on the phone. And yes, it is free. If you have not rated us, please rate us and please give us a 5. It'll help other people just like you to find us faster. And lastly, if you haven't subscribed, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.